Welcome to a new episode of Medicine in 3 Minutes. As usual, we go straight to the point. The subject is made brief, clear, and often illustrated. Let us start. Blood supply vessel to the brain. This presentation includes several videos. Select the topic plus Medicine in 3 minutes. First video, blood vessels of the brain. Cardiac output to nervous system. First aortic triangle. Second anterior carotid system. Third posterior vertebral system. Second video, carotid sinus, 1 carotid reflex. 2 carotid sheath. Third video, classification of internal carotid artery. 1 cervical segment. 2 petrosal segment. 3 lacerum segment. 4 cavernous segment. 5 clinoid segment. 6 ophthalmic segment. 7 communicating segments. How much of cardiac output goes to the central nervous system? In a normal resting, a person's heart produces 5 liters/mn of blood. 15% of the volume is devoted to the central nervous system through 2 arteries, carotid system and arteriobasilar system. This illustration makes it possible to differentiate, first the artery systems intended for the brain. It is called the anterior or carotid system in red. Second, the posterior or basilar vertebral trunk. In purple. These 2 systems communicate with each other thanks to the communicating arteries in green. They constitute the Circle of Willis. We will study and detail the components of the 3 systems, carotid, vertebral, and Circle of Willis. Do you want to note that the carotid artery emerges from the brachiocephalic trunk? This diagram represents the arch of the aorta. The arch originates from the left ventricle of the heart. 2 large arteries emerge from this arch. First, the brachiocephalic trunk. This trunk gives rise to the right subclavian artery and the 2 common carotid arteries. Second, the left subclavian artery. The left and right common carotid arteries ascend up the neck, lateral to the trachea and the esophagus. They do not give off any branches in the neck. At the level of the superior margin of the thyroid cartilage, C4, the carotid arteries split into the external and internal carotid arteries. Carotid Triangle. The carotid triangle is a space at the anterior portion of the neck. It is bound by the sternocleidomastoid muscle, the superior belly of the omohyoid muscle, and the posterior belly of the digastric muscle with the stylohyoid. The carotid triangle is a space at the anterior portion of the neck. It is bound by the sternocleidomastoid muscle, the superior belly of the omohyoid muscle, and the posterior belly of the digastric muscle with the stylohyoid. A point on the anterior border of sternocleidomastoid muscle at the level the upper border of the thyroid cartilage. B. Second point on the posterior border of the neck. The artery is slightly convex forward on its lower half, and slightly concave forwards in its upper half. Carotid sinus. Carotid body and carotid sinus. The carotid body is a small cluster of chemoreceptor cells located in the adventive of the bifurcation of the common carotid artery. It detects changes in the composition of arterial blood flowing through chemoreceptors for O2 level, CO2 level, pH, temperature. The carotid sinus is a dilated area at the base of the internal carotid artery just superior to the bifurcations at the level of the superior border of thyroid cartilage. It is baroreceptor sensitive to blood pressure. Carotid sheath. The carotid sheath extends from the arch of the aorta to the base of the skull. The upper part is attached to the margins of the carotid canal and the petrous bone. Here it contains the internal carotid artery and internal jugular vein, and the last 4 cranial nerves. Between the internal and external carotid pass the styloglossus muscle, stylopharyngeus muscle, stylohyoid ligament, glossopharyngeal nerve, a pharyngeal branch of the vagus nerve. Carotid plexus. Carotid plexus. The sympathetic trunk forms a plexus of nerves around the artery known as the carotid plexus. The internal carotid nerve arises from the superior cervical ganglion and forms this plexus. The carotid plexus follows the internal carotid into the skull. The internal carotid plexus is situated on the lateral side of the internal carotid artery inside the plexus. The carotid ganglion lies on the undersurface of the artery. Internal carotid classification. Internal carotid classification. The classification has the following 7 segments. C1, cervical, C2, petrous, C3, lacerum, C4, cavernous, C5, clinoid, C6, ophthalmic, and C7, communicating. This classification is practical, accounts for new anatomic information and clinical interests, and clarifies all segments of the ECA. The cervical segment, or C1, or cervical part of the internal carotid, extends from the carotid bifurcation until it enters the carotid canal, anterior to the jugular foramen. At its origin, the dilated artery is known as the carotid sinus or carotid bulb. The internal carotid runs vertically upward in the carotid sheath. The artery enters the skull through the carotid canal. During this part of its course, it lies in front of the transverse processes of the upper 3 cervical vertebrae. I recall the 2 systems that drain blood to the brain, the carotid system that we have just seen and the bacillary vertebral system that we are going to discuss. Internal carotid artery. Internal carotid artery comes out from foramen lacerum, moves within the cavernous sinus and medial to anterior sella turcica clinoid. It turns up sharp to pierce dura mater and arachnoid mater to appear in subarachnoid space. Important structure. Vertebral arteries come from the subclavian artery. They reach the lateral part of the medulla. They meet each other at the pontomedullary junction. Then they move together as unique trunk called basilar artery until terminal branches as posterior cerebral arteries above third cranial nerve origin. The Circle of Willis. The Circle of Willis. The Circle of Willis, also called Willis Circle or Loop of Willis, or Cerebral Arterial Circle, or Willis Polygon, is a circulatory anastomosis that supplies blood to the brain and surrounding structures. The circle is composed of the following arteries: anterior cerebral artery, right and left anterior communicating artery, internal carotid artery, right and left posterior cerebral artery, right and left the middle cerebral artery, right and left that supply the brain are not considered as part of the circle. Loop of Willis, or cerebral arterial circle, or Willis polygon, is a circulatory anastomosis that supplies blood to the brain and surrounding structures. The circle is composed of the following arteries: anterior cerebral artery, right and left, anterior communicating artery, internal carotid artery, right and left, posterior cerebral artery, right and left. The middle cerebral artery, right and left that supply the brain are not considered as part of the circle. Thank you for watching this episode of Medicine in 3 Minutes. Please click the like button and subscribe for more videos. Your comments are very welcome.